get through this so we can get out of here.
I agree. I love all of you, but
No offense, but I
But-
want you to go home.
But are we able to see the now? Cause I'm here, I'm not,
same bar or
I'm sorry, I know I'm being a pain in the butt.
there we go.
Okay, the film holder. The film holder containing a ring used to line up the cone also functions as a safety feature because it allows the operator to aim the beam at the center of the film. This reduces the possibility of a cone cut that would necessitate a retake. It also doubles as a patient, it also is a paralleling device in this example, which limits retakes. It produces a more accurate image than the alternative bisecting the angle. Okay, so this is a film holder. This is a film holder, and this is going to be our pretend PID, okay? The positioning indicating device. We're able to put it directly so it aims at the proper distance from the face. It provides protection because it's aiming the beam directly at the center of the film. The film would sit here like this. These are tight. Would sit there like this. You can see that it's aimed directly. It's aimed directly at the film, the center of the film. And if this is placed correctly with the long axis of the tooth that you're aiming to get, you're going to have a perfect x-ray and you're not going to have to do any retakes. So this is a film holder. This is also a film holder. This one does not have an aiming device. You just have to really be good to make this work. But this is called a snap array because it kind of snaps. And let's see. Okay, fits like that. Let me get my big old mouth. Now maybe actually one of these other type it up would be better because it's more real sized. You would, so this would be for the left side. So you would, pardon me. To take a molar, PA, you would place it, have the patient bite down on this little table kind of looking thing, platform. Then you would have to aim it and you'd have to know where the long axis of the tooth is. I mean, you're freehanding it when you're doing it like this, okay? But it works, especially if you have somebody who can't tolerate the rins. For film, that works best for film. Excuse me, ladies, I'm sorry, I don't mean coughing on y'all. Okay, so the film itself, and I have film for you guys out, because we're gonna open it up and look at it, and see how it's comprised, what's made up of. Okay, so go ahead and open up your film. Well, wait a minute, don't open it just yet. Okay, the outside is just it's a plastic envelope. If we open the plastic envelope, the first thing you see is a tab with some dark paper. Just go ahead and pull that everything out. And then this is just empty now, so you can put that down, the envelope. The envelope helps to protect against light getting to the film. It also protects against moisture getting to the film, and it also makes it more comfortable for the patient. Okay, so when we pick up our film, you see aluminum, it's actually lead, sorry. It's a lead foil, okay? What do you think the lead foil does?
Stops the radiation.
Exactly. When it is exposed, it prevents that backscatter, prevents it prevents the x-rays from coming back. So it prevents scatter radiation. The black paper is just to prevent and protect against light exposure. And then the actual film itself is a celluloid sheet. It's flexible. The green on it is an emulsion. It's covered with an emulsion that has silver bromide crystals and some other chemicals that make the image viewable. Okay, so that's the components of your film. You'll also notice down on your film, down in the lower corner, or one corner, there's a bubble. Okay, that is your dot. Okay, when you're placing your film in your film holder, you want to put your dot in the slot. So you put the dot facing down in the slot. Okay, and that's for, it's a mounting tool. It tells you right from left, whether you're looking at it from the tongue or the face side. So it's a mounting tool. Okay, all right. So, the film itself includes a sheet of lead foil at the back of the packet that protects the surrounding tissues from unnecessary exposure and from backscatter to the film from the adjacent tissues. It also the development of high-speed film, the higher the speed, means the more chemicals that are on the emulsion, make it possible to reduce the amount of radiation that you need to take x-rays. Digital sensors even require less radiation. That's one reason we've gone to the digital. Another reason that we've gone to the digital is film, you have to buy the film, you have to buy the processing equipment,
Yeah, black room.
you have to, once the processing solutions have been depleted, you have to pay to have them picked up. So you're paying 3 times for that one x-ray that you took.
And it also, like, you're paying for time too, like,
It takes more time.
so much.
And so it's way more costly. Up front, it looks like the digital is more costly, but once the equipment's paid for,
You're done.
you're done, okay? Plus, if I want an x-ray, all I have to do, it's a matter of seconds that he can see it, rather than minutes or hours, depending on which way we have processed the films. Okay, so it's definitely a money and time-saving deal. But the biggest advantage is that it reduces the radiation, okay? So faster film, the faster the film, the less radiation. The physical setting of the operatory where you take the x-rays is also controlled. The walls in the room act as a preventive barrier to block the radiation from the other parts of the dental office. Sometimes if the building is real small and a lot of walls are shared, they might have lead in the walls. Most offices don't have lead in the wall anymore. But that's another way that you can prevent, you can be more safe. Okay, protecting the patient. Okay, next film. Next. Is it this one? Yeah, cool. Okay, there's another part that's highlighted. I wonder why. Okay, in addition to the safety features of the equipment, there are ways to protect your patient from unnecessary exposure to radiation. Radiographs should be taken when?
Only when necessary.
Only when necessary. The dentist is responsible for deciding which patients need to be x-rayed and what types of views need to be taken. This reduces the amount of exposure of radiation to the patient and the operator. So if I asked, who's responsible for deciding which x-rays to take, the answer is the dentist. If I ask, when do we take radiographs?
Only when necessary.
Okay, not every 6 months? Not every year?
I mean,
Not every 3 years, every 5 years? When do we take radiographs? Only when necessary, okay? There is no time frame, okay? The time frame since the last x-rays is used as a tool to help the dentist decide who he thinks needs to have x-rays done. In most dental offices, I'll be honest with you, in most dental offices, there's a policy. I want bite wings taken every year. I need to see bite wings on patients every year so that I can check for decay between the teeth. The doctor feels that's necessary. So he tells the hygienist, I want bite wings taken every 6 months. I want a full mouth series taken. If the patient has not had any problems for 3 years, fine. Let it go to 5 years for a full mouth. It's a patient of record. A new patient, you want to see everything. It's necessary to make a complete diagnosis because you want to be able to see everything in the mouth. So he might say, on new patients, I want them taken every year. What if the patient had it done last year? Well, we're going to take bite wings today, and we're going to request those x-rays to be sent over, okay? There is no timeline. On the test, it's going to ask you every 6 months, once a year, only for toothaches. I mean, it's got all kinds of scenarios for you, and the only correct answer is only when necessary. All right? Okay. A lead apron should always, that's a modal term meaning always, forever, now and forevermore. Okay? It should always be used to cover the patient's body to protect from scatter radiation. I don't care if you're taking one x-ray or if you're taking 20. I want you to use the lead apron every single time. It's for the patient's safety. You don't know what's going on in their body. You don't know, you don't have any way of knowing. A thyroid collar is highly recommended. I do teach you to use the thyroid collar. Whether you use it when you get out into practice, that's between you and your employer. But for me, I want to see the thyroid collar on whenever we're taking x-rays. Okay? You need to know how to use it. There's a specific way to put it on, and we'll go through that when we get to lab, when I'm showing it to you. It gives added protection to the thyroid and the parathyroid glands in the throat area. Sometimes the collar is attached to the apron and sometimes it's not. Whenever a patient is an infant or a toddler and they can't sit in a chair by themselves and they won't sit, it's acceptable to have the parent holding them, but they both have on lead aprons. The thyroid collar and the apron should be stored unfolded to prevent damage. You're going to see in the back that the lead apron is folded. It damages the lead. It's basically a lead foil. It's thicker than what's in your film packet, but it's basically a lead foil, and if you bend it enough, it will break, and then it's useless. So, unfolded. Lead apron should always be stored unfolded. Okay? see a lot of things when you get out into practice that are way different. I'm teaching you the law of it. Okay? Hopefully you'll do this way when you get out into to practice. Correct technique is essential to the patient protection. The aiming the beam at the correct teeth and centering the beam on the film can minimize the exposure of the adjacent tissues and reduce the need for retake of the radiographs. Paralleling technique is designed to do just that. So there's 3 ways that we protect the patient in the practice when we're doing radiographs. We're going to take only the radiographs that are necessary with the dentist prescribing them. We're going to always use a lead apron. Always use a lead apron. We're going to use correct technique. So that's the 3 ways that we protect the patient. Okay, now let's protect the operator. Next page, please. We're going to stand behind a barrier. When you're exposing a radiograph, you want to stand behind a barrier that is lined with lead or provides adequate protection from scatter radiation. If you can't get behind a barrier, and you'll see me doing this technique when we get into lab, is standing back away from the beam 6 to 8 feet from the x-ray head, and the x-ray head is away from, I'm standing away from the path of the beam. In other words, if the beam is aimed this way, I want to be behind it. Okay? You want to be away from the path of the beam while taking your x-rays. You never hold the film for the patient or attempt to stabilize the head of the x-ray tube when you're exposing. Okay? Reason for that is your patient can hold it, or the parent, if it's a child, the parent can hold it. The reason that we do that is they get 1 dose of radiation. What if you have 3 patients that day that need that service? Then you've gotten yourself 3 doses of radiation, and it's cumulative. It adds up. It adds up. So you want to have as little radiation exposure as possible. Okay, so you never hold the film or stabilize the tube head while you're taking an x-ray. The 3rd way that we protect ourselves is to wear a dosimeter badge. We talked about a dosimeter. What is the dosimeter? It measures cumulative exposure. So, operator exposure is really unlikely if you follow the rules that we've set here. A dosimeter badge can be worn to measure the amount and the type of radiation exposure. It should only be worn while you're in the office. It should never leave the office. A periodic reading is provided. The periodic reading, it can provide important information about the exposure. The maximum dose standard set by the government is highlighted. I wonder why. Maximum dose standards set by the federal government allow for 50, let's see, max dosage is 50 millisieverts or 5 rem. 5 rem to the whole body dose, a whole body dose in 1 year. Okay? 5 rem is the answer on the test. But it's also calculated in 50 millisieverts. Okay. It's just a different, I don't know why they even throw that in there, other than millisieverts sounds cool. But it's 5 rem per year. You know, slash means per. Okay, so 50 per year. Questions on that?
No.
Okay. We generally don't wear dosimeter badges. I'm gonna be getting a dosimeter badge for LCCC. Maybe, I haven't got it yet, been there a month, but I don't care, either way. But, I did wear one for a while in, when I was an assistant in St. Louis. And if I do get one from LCCC, they will have to have all that other information added to all the information that's been collected on me my whole life will be continued on this new dosimeter badge that I'll be getting. So it measures for your whole body, lifetime, cumulative dose. That is, if the company's still even in. Okay, patient management, we're still back. Yes, we went too fast. Okay, you have to remember that your patient will usually not have as much knowledge about dental x-rays that you have. Knowledge can bring confidence. The patient will have confidence in you. You'll have confidence in yourself. And it also gives you a feeling of safety, that you know that you're going to be operating within the standards of safety. You can give your patient reassurance as to the safety of dental x-rays by providing the basic information. When you're preparing for the x-rays, remember to do the following. You want to listen to your patient's concerns. I'm going to take x-rays on Ashley, and Ashley says, but I've just had a bunch of x-rays at the hospital. I hurt my leg and I've had a bunch of x-rays. The dosage that we're going to give you is a tiny, tiny, tiny amount compared to the amount that you got at your leg x-ray. I've heard that x-rays can give you cancer, or whatever. There's a whole plethora of excuses out there that patients don't want to have x-rays done. Because Dr. Oz got on TV and said, x-rays are bad for you. So now people don't want to do it because they believe Dr. Oz over Dr. Cutler. He has a dental degree. This guy has a heart, he's a heart doctor. Listen to the professionals that know what they're talking about, okay? You can address each one of their concerns. Remind them that if we use fast film or digital radiography, that it's extremely low. You're going to get more radiation living in a brick house than you will from the dental x-rays the full mouth x-rays that we expose in the office. Okay? So you can remind them of that. But address each of their concerns and stating relevant facts about the dental x-rays in a confident manner. If you speak to someone with confidence, they're going to believe what you say. Then if you hem and haw and, and I always start when somebody has a concern, I say, I understand what you're saying, and then address it. You want to be specific in the ways in which the exposure is kept to the minimum. You're going to tell them, I'm using a paralleling technique that reduces the need for retakes. You can go as far as you need to with this whole course. You can just recite the course to them, okay? You want to use language that they understand, okay? And they use terminology that they can understand. Okay, now we're gonna talk a little bit about, procedure and infection control. Okay, what is cross-contamination?
It's when you do one thing and you don't clean up after it, and you do another thing, and there's
Just
a
spreading.
spread of disease.
Okay, I have licked my finger and I've cross-contaminated, okay?
Yeah.
My germs are now on this book, okay? I have taken an x-ray and then I've gone and, put the RIN down on the counter, okay? I've cross-contaminated. I've taken the saliva from the RIN and I've put it on the counter. I've cross-contaminated. It's the spread of disease-producing matter from one person or object to another, okay? Infection is an invasion of the body by the disease-producing organism. So, in infection hazards, during the x-ray procedure, saliva and gingival fluids are present. These potential contaminants can get on the film that is placed in the mouth and can transmit infection to others if control procedures are not followed. In addition, poor infection control techniques can cause the patient to become infected if a contaminated film packet is placed in the mouth. So you want to always keep your contaminated, not processed films separate from your processed films. I worked in St. Louis, in a big office, and we had several assistants, and standards were way, way lax, way less than what we have to do now. So we would put our x-ray film in our pocket, and one pocket, and then the other pocket was for the contaminated ones. Okay, now this is not smart. I'm not proud of this, okay? This is not part, but if you got mixed up and you reached in and put, then you've double exposed an x-ray. Okay, that could happen. Also, let's say I have a pocket full of undeveloped radiographs and I'm gonna take one on a toothache patient on my way to the dark room. So I reach in the wrong pocket and I've taken Talen's x-ray and I've double exposed it on Leslie. That's cross-contamination and double exposure. So you need to be in control of your exposed films at all times. You know that they're separate, completely separate from any other radiographs, okay? Okay. In order to prevent cross-contamination, we're gonna prepare the room. All the surfaces in the room have to be clean, and this is done in two ways. You're gonna disinfect with a surface disinfectant that's EPA approved. You're gonna use clean, removable barriers to protect irregular surfaces. You're gonna prepare your materials, okay? We need to go through these each step because this is, you're gonna have to put them in order, okay? So the materials that you're gonna be needed, you're gonna have them prepared in advance. You're gonna have gloves or over gloves, paper toweling, a cup to transport the exposed film to the dark room. You're gonna lay the films to be exposed on a clean paper towel in an adjacent room. The film holding device should be brought into the operatory while it's still in its autoclave bag. The bag should be opened in full view of the patient and the holder placed on a clean paper towel on the operatory counter. Why would you want to open it in front of the patient?
So they know it's clean.
They know it's clean without saying, this is clean. That's what this says. See all this? This is clean. Okay. If you're using a direct digital imaging sensor, bring the sensor and the plastic bag into the operatory. Since the sensor cannot be autoclaved, it must be placed in a sterile bag before it's placed in the mouth. They cannot be autoclaved. They can be wiped down with, the Steri-Wipe deals, but you can't autoclave them. It's an electronic gizmo and it would fry it. Okay, so you absolutely cannot autoclave it. During the procedure, you're going to want to remember to consider everything that has been in contact with the patient's saliva as contaminated. You're going to wear clean gloves or over gloves when handling the film. After an exposure, you're going to remove the film and the holder from the mouth, wiping the saliva and with a clean towel. So you're going to remove the film. You're going to remove it, wipe it with a paper towel, and put it in a clean cup. But you're not going to touch the outside of the cup because your hands are contaminated and the cup is not. So you have to carefully put it in, I wish I had a cup. Put it in the cup without touching it, okay? Pick up your next clean film, you go back into the room, expose that film, come back and this is why we don't use film anymore, okay? But this is what I have to teach you. Okay, so after an exposure, you're gonna remove the film and the film holder from the mouth. You're gonna wipe the saliva with a clean towel, remove the film from the holder, and place the holder on the paper towel in the operatory. You're gonna carry the exposed film to the adjacent room and drop it into the exposed film cup, okay? Carefully, not to touch the outside of the cup with the contaminated gloves. You're gonna bring in a new unexposed film back into the operatory, load the film holder, expose the film, and repeat the process. Okay? Are you with me so far?
No.
Okay. You're gonna observe infection control procedures while you're processing the films. This usually means wearing gloves while handling the packets that have been exposed to saliva and then discarding the gloves. So you're going to, basically when you're in the dark room and after you've already finished, you're going to have your gloves on and you're going to you're gonna have a clean pair of gloves on. You're gonna take the films out and put them out on the towel, all the films, empty, and you'll have all these sitting on your towel. Okay, they're not because the way you open it, they fall out onto this so you're not contaminating the film itself. Then after you've done that, and we're gonna get into this more into the developing part. You're going to discard your gloves and then use this to load your processor or load on your clips if it's manual. If it's an automatic, you'll feed it into the automatic processor, depending on what kind of equipment you're going to use. But this is the infection control part of it, okay? You're going to observe infection control while processing the film. This usually means wearing gloves while handling the packets that have been exposed to saliva, then discarding the gloves. An advantage of direct digital imaging is that the same sensor can be used for all exposures. There's no film change. You use one piece of equipment. Instead of 18, 20 films, you have one receptor. And it's usually equivalent to the size 2 film, which is this. This is a size 2 film that I gave you today to look at. Until you reach the mandibular anterior, and then you're going to use a smaller sensor. Not in this office, but you may. Okay, in some offices they do utilize the smaller sensors. Okay, so we've gotten through the procedure. We've taken all of our X-rays. Are we clear up to here?
Yes.
As far as infection control, Leslie, you got me? You with me?
Yes.
Okay. All right. So after the procedure, we're going to remember to, after exposing the last film and placing it in the cup, we're going to remove our gloves. You're going to remove the patient's apron and thyroid collar. You're going to dismiss your patient. Okay? This is for a full mouth patient only. is not like we're gonna still do some more stuff. Okay, let's just say they came in only for x-rays. So this is what we're gonna do. We're gonna dismiss the patient. We're gonna remove all the barrier coverings and replace them with clean ones for the next patient. We're gonna use disinfectant on the surfaces that were not protected. We're gonna discard the contaminated gloves and other disposables. We're gonna autoclave or sterilize the film holding device according to the manufacturer's instructions. If you're using a sensor, you're gonna carefully remove and discard the plastic bag, being careful not to contaminate the sensor. Remember that the sensor cannot be autoclaved. So once you take the sensor out of the little bag, it's a good idea to take this cavi wipe or whatever and wipe it down. The sensor, you don't wanna saturate it with solution, but you do wanna wipe it real nice, and the cord handle as well. Okay, questions?
No.
No. Okay, I have some. Yeah,
Do you want this?
yeah. Oopies, yeah.
I don't know where it is.
Don't know where it went, okay. What can be aimed in a desired direction, Leslie? Can x-rays be aimed in a desired direction? Yes?
Yes.
Visible light?
Yes.
Okay. What can pass through a solid object? X-rays?
Yes.
Visible light?
No.
No. Can be seen with the naked eye? Leslie?
Visible light.
Yes.
No x-rays, yes. Visible light.
Good. It is a form of electromagnetic radiation. X-rays?
Yes.
Visible light?
Yes.
Yes. Excellent. Okay. X-rays are produced within a tube head, within a tube located in the X-ray head. As the X-rays exit the cone of the machine, a
Focus. Is that, no, primary.
primary beam is created. When X-rays strike the film, a
Absorb?
chemical
Chemical radiation?
chemical reaction produces a
Lighter.
lighter area on the developed film. If an object is in the path, some of the radiation is
Absorbed?
by the object. This reduces the amount of
Radiation?
penetrating to the film, resulting in a
Lighter?
area.
If it
Which
hits
one's
a
lighter?
tube, if it hits a tube, it's a lighter area on the film.
Correct. Resulting in a lighter area on the film after processing. This contrast of light and dark areas produces images of tissue structures that the dentist can use to make a
Diagnosis.
perfect. Did I have those answers up there already?
No.
Okay. All right, and then, I want you to I want you to, the next page says, making radiographs, okay. So, in this section, the human tissue that is especially sensitive to radiation is listed. Circle the 3 that are most important in dental x-rays. The others are not affected by properly administered dental x-rays.
Thyroid tissue,
Yes?
red and white blood cells,
Yes?
and bone marrow.
Yes. Cells of the embryo and gonadal tissue are not usually exposed in dental x-rays because we have on thyroid. Lead apron and thyroid column. Okay. Okay. Again, do the post-test, do the because that's just study, it's study guides, okay? And then your, If you understand your glossary, if you understand all these terms in your glossary, you're gonna understand the questions when they come up to you on the test. Okay, you'll understand how to figure out the word. Would you stop it? Behave. Okay, that's book 2. How are we doing on time?
It's 10. Barb wanted, to know when you were done, so I think she wants to come in here or something. We
You're
done.
done with that particular book?
The book.
The book? Okay. Wanna
I guess we'll see
turn
what she
this off
wants.
then and let her,
I'm gonna go to the restroom.
yeah, now's a break time. Break, break, break. Break, break.
Break.
Leslie, how are you doing?
I'm good. I'm just like, I keep spacing out, so that's just why I'm like,
It's tough.
Yeah.
This is not an easy subject to discuss. And stop me, stop me if you need me to.
Break time.
Are we still filming?
Oh, yeah.
Pause me.
That's silly.
Oh, how do you stop this thing?